Aloha, my name is Asia, and I will be presenting on Hawaii's childhood obesity and developing healthy eaters with farm to early care and education. Here is some of my abstract, but basically this project I am presenting on will describe the implementation and proposed evaluation of ECE in Hawaii by providing training and educational materials to ECE professionals and parents of the young children. Here are the 4 determinants I started off with. Childhood obesity is a major public health issue. Starting healthy eating habits and weight management from an early age gives a developing body nutrition to grow properly, decreasing the risk of diseases. I'm going to skip over determinant 2 and go into 3 right now, and you'll see why in just a moment. So, with no local farmers markets, your fruits and vegetables will not be as fresh as compared to getting them from the grocery store where they have to be picked early. Food imported from far away is older and has traveled on trucks or planes and sat in warehouses before it got to you. Many don't realize, but local produce markets are also places for your children to learn about nature, agriculture, and nutrition. With more access to fast food than local farmers markets, people of all ages will tend to go for the fast food rather than the healthy, fresh foods. Included with fast food, soda, and other sugary drinks are the single largest source of excess sugar in the American diet and contribute to the overall obesity epidemic. So going to number 4, clean water is essential in children's development process. Nursing infants and young children have a much higher water requirement than adults. Another factor is unavailable health care. This is a factor that would also need to be prioritized because those living in low-income communities tend to have the greatest health needs. These, as you might say, cradle-to-grave health services are needed to provide the basic care needs that a child might need growing up. Now going back to determinant 2, this is the one I decided to prioritize, and this is why. The health problem of childhood obesity and malnutrition results from not having the proper resources and opportunities to learn to eat healthy. One factor contributing to this is a lack of knowledge in schools and at home. And a program that can help with increased knowledge of early nutrition is Farm to Early Care and Education, or also known as Farm to ECE. This is a beneficial program for all children, parents, teachers, and providers. With this determinant, I chose to go further in depth to help decrease the health issue of childhood obesity in Hawaii. I had found several existing studies and program interventions and narrowed it down to 2, the National Farm to ECE Network and Hawaii Public Health Institute's Farm to ECE program. With both, I learned Farm to ECE increases access to healthy, locally grown foods through local food procurement, which enhances the total well-being and engagement of young children and their families. A little background data on this type of program's effectiveness is in the 2018 National Farm to ECE survey. They heard from over 2,000 sites and are serving over 255,000 young children in 46 states. The Farm to ECE network is definitely reaching far and wide. About 49% of respondents are already participating, and another 34% sites serve more than 50% of low-income children. Cost-wise, local government funding as well as help from the state will be needed to continue on with a program like this. Cost of supplies and staffing the program will need to be approved and funded, as well as staffing the program with the minimum of who it needs. Because I am focusing on childhood obesity specifically in Hawaii, I chose to further this intervention based on HIPHI's Farm to ECE program. Implementing programs statewide based off HIPHI's Farm to ECE program will significantly decrease childhood obesity in Hawaii. What I want to talk about here is the priority population being served under this program. It will be young children who are recipients, students, patients of early childhood healthcare, and educational professionals in Hawaii. The age range here is set from birth to 8 years of age because we will be focusing on early care for young age children during their early developmental stages. With this age range, the program will be delivered in several settings such as schools, hospitals, clinics, and even at-home learning. There will be 3 different types of interventions taking place throughout the program. The focal point of the primary intervention is developing healthy eaters among ECE recipients. This aims to reduce the risk of childhood obesity among ECE recipients. The secondary focuses on the early detection of childhood obesity, which has the possibility of heading towards adulthood obesity. And then the pivot of the tertiary will be knowing there is childhood obesity present, and from here the program will then push to get the recipient on the right track to eating healthy and a healthy lifestyle. Going over some of the proposed evaluations. For the process, we look at funding, materials, and the collaboration network. Here we ask ourselves questions such as, did we receive funding targets from National Farm to School Network or HIPHI or even the Department of Health? And also, was it sufficient for the specifications and outcomes? For materials, we ask ourselves, how's the development of the website? Did we develop promotional materials such as flyers, and are the flyers distributed and uploaded to the website as well? And then also asking if there are any inter-island or interagency conflicts and how well did we respond to this? For outcomes, there will be evaluation on if outreach professionals are reaching out more to communities around the island and the overall state. And then we ask if there's a statistically significant increase of recipients following a healthy diet. And a big one is to see above 35% of participating sites serving 70% low-income children. With the impact evaluation, we want to see a decreased risks of childhood obesity and also in percentages of children with risk behaviors of childhood obesity, and then to see an increased enrollment to ECE among low-income children. Most schools around the United States do not provide appropriate amounts of knowledge in early care and education systems, leading to the downfall of children's nutrition education. With the way a program like Hawaii Public Health Institute's Farm to ECE program is set up, this program could be as easily accessible and passed off to another organization to sustain if needed be. Thank you guys so much for listening.